Hello, welcome to the Chronicles of a Ghanaian Diaspora Nurse, the return. Thank you so much for tuning in again. I have a question for you today. Do you have family or relatives living in a rural area in Africa? I mean, the close family members and the not so close, the distant and the extended family members, some of whom we may not even have been in contact with for a while. If we all honestly look back, we would have a relative living in a rural area somewhere in Africa. The question is, what healthcare services are available to them when they become unwell? Today, I'm bringing you an update on a conversation I had with a physician assistant based at a rural clinic at here in Ashanti region in Ghana. But before I give you the update, let's take a look at the conversation we had.
To us. And then major challenges, as we talk about it earlier on, we have converted a building which was meant for staff accommodation to be used as ward. Then
Okay.
it was started about 5 years ago, but due to inadequate fund and then support, we are still on it. But gracefully, we finished with the roofing, plastering, and then wiring. We are there, fitting, and then the I think some finishing practice. We've been able to purchase the doors and then the keys. We are waiting for the carpenter to come and fix it. So we are also pleading and then requesting for beds, hospital beds, and then other equipment, lockers, and then drip stands, and then any material that will help us to move into that way. Because currently, when we detain patients, both children, male, female, pregnant women, we just put them together in the same room,
They're all
which
in
is
the
not.
same room. Okay.
They are all in the same room for that one day. Aha. So, but for that made us to decide to use that building for detention room. But so when we are able to move over there, we were able to get a male room, male ward, female ward. Then the maternity people will also get them, and then children's ward. Aha. So we are.
One of the objectives outlined in my intro video was to have a call to action to make an impact to healthcare delivery and education in Ghana. We haven't yet made a formal call to action, but guess what? We have a donor who is supporting the clinic with equipment, medical items, and in so many more amazing ways. I had the privilege of visiting here recently. Ghana has an estimated population over 31 million people, with nearly half of them living in the rural areas. My trip to here itself was uneventful on the day. I traveled on a public transport to here, and I am going through the biggest indoor market in Kumasi to board a bus. So that's me boarded on the bus and enjoying the lovely scenery on the road to here. So I had to go through to Jakobu, take a taxi to here, and boom, we are at here. This is the here village center. The village comprises of a population over 3,000 people. So you can see Mike, the teacher who went with me. So we are at the consulting room at the clinic and having the welcome, as we call Amania. Then on, we had to go around the facility, and I must admit, there is a bunch of dedicated and enthusiastic nurses working there. You will just love them. We went through the ward. As you can see, as she said, a man and woman in the same ward. and had a chat with the midwife, which I'll bring you an update later in a separate video. So we are going towards where the building is. The nurses also spoke about the child welfare clinic being held in the open space. This is the nurses' accommodation building, which is being turned into wards. And thanks to our donor, we have 10 hospital beds. These beds have been assembled for display only for my visit. As you can see, the rooms are not yet completed. So there are 10 beds in all. We have 3 here, and we'll be getting the rest very soon. And yes, we have a drip stand. Each bed has a drip stand. So the facility actually sits on a 48 acre of land. There's vast land around it. We also donated sutures, anesthetic medication, and other items. And since I left, work began on the septic tank. And again, our donor, who is a diaspora healthcare professional, is supporting with this. This goes to show that we are able and can make a contribution, be it equipment, donation, or capacity building, or skills sharing. We all can make a difference. So the septic tank is built now. Stay tuned for more updates that I'll be bringing you.